welcome to Sleep Week. We are here with one of our very special Amen Clinic doctors, Shane Creado.
Hello,
Dr.
everyone.
Creado is a psychiatrist, but he's also an expert in sleep medicine. He did a sleep medicine fellowship at the University of Wisconsin, and he is passionate about getting you to sleep.
Which I'm passionate about too. So in our last podcast you did with us was so great, and it just did so well. So
That's
we're
wonderful.
excited to have you back.
And we have a new course
We do.
that Dr. Creado has created. It's a 21-lesson course. Sleep is one of the most important things you do.
And it's one of the hardest things for some people. I know I certainly struggled with it after my thyroid issues. And after stressful things like a divorce. I mean, people just really struggle with this. We hear from people all the time about this issue.
Yeah.
So, yeah.
And it was stressful last night.
Dear
And
Lord. So sometimes it's not even your issues. Sometimes it's your spouse.
So I've not
very
been
true.
feeling well. I've had sort of a sore throat and a little bit of a cough. And apparently, what she
Sound like a
says,
freight
because
train.
I didn't know,
Freight train.
is she's just beating me up.
I wasn't beating him up. I'm trying to get him to roll over and move his head. And all of a sudden he's like, stop abusing me. I'm not
So I
abusing
went
you.
and slept with a cat.
So neither
but
one of
this
us got
is-
much sleep last night.
But this is not uncommon. I actually was talking to a patient last night, and one of the big issues in their marriage is
sleep.
his snoring.
Yes. No, I know a lot of couples who start sleeping separately because of snoring. Now, I wear earplugs because you often snore lightly. But there are times, so after you travel, I already know the pattern.
We're doing a therapy session here.
No, I'm actually bringing this up
I'm
because of other
observing in
people.
silence.
Yeah, because other people bring this up to us.
Yeah.
So after he travels, because I notice his circadian rhythm is a little off,
Right.
and he's more tired. After he travels, he tends to snore very loudly, and
Makes
it's
sense.
harder to sort of roll him over.
Yep.
Normally, I can roll him over and he stops. It's like he'll different positions will change that. So, but after you travel, or when you're sick, or when you've got something very stressful and you're not sleeping like you normally do, that's when I notice it. So, and
So it was
likewise,
actually it was stress last week. I had some stress, which then made my immune system more vulnerable because I hardly ever get sick. So stress, immune system vulnerability, snoring, wife abusing you,
More stress.
more stress.
And then if you add that on to, if you're having, like the spouse, if you're having any kind of stressful situation in your life where you're not sleeping quite as soundly, now you've got this combination, right? Am I wrong here?
Oh, you're absolutely right.
Because you're the expert on this. I just am experiencing it. So.
That's exactly what we go for, right? It's always the person's experience that we go with. We start there. What's your subjective experience? I'm not going to tell a patient this is exactly what you need to do. It's what their goals are. And that's how
Right.
we connect with somebody and help them along their journey.
Excellent. So
why do we sleep?
Sleep is one of the most important things we need for survival. In fact, there's something called fatal familial hypersomnia and insomnias as well. If you don't get enough sleep, you will die. So people say you need food, clothing, shelter. I say you need food, clothing, shelter, sleep.
isn't that why they do torture, like sleep deprivation as a form of torture?
Absolutely. If
Now,
you're
why
sleep
is that the
deprived-
first thing you think of?
Because I have a warrior mentality.
In fact, if you are sleep deprived, no sensory stimulation as well, your brain will start making things up. You will hallucinate. You can go crazy.
You know, I was the chief psychiatrist at Fort Irwin, which is in the middle of the Mojave Desert where we fought the soldiers, the tank divisions, to fight the Russians in the desert. And their war games would go on for days. And I would often see people get psychotic.
Right.
And come to me because they hadn't slept for 2 days.
Yes.
Now, the treatment for that is not an antipsychotic. It's sleep.
Yeah.
Yes.
We had ICU psychosis. So when I worked in a trauma unit,
Yeah.
ICU psychosis was when, because all of the noise and the beeping and the helicopters coming in and the patients didn't sleep.
Yes.
And so they literally would start hallucinating. They'd start screaming, trying to rip stuff out of their arms. We had to give them medication to go to sleep.
Exactly
So-
right. Same thing with Jerusalem syndrome, where people travel to the Holy Land. They get off the airplane and they're psychotic with one night of sleep deprivation. You can go psychotic, and you're right. No antipsychotic medication there. They're sent on the next plane back home, and they're fine.
Weird.
Oh, how interesting. So why do we sleep?
It's needed for most of your functioning, for your immunity, for proper blood flow, for restoration, for memory consolidation. If you've noticed even one night of sleep deprivation, you'll be more irritable, more cranky, especially if your spouses disturb you.
Yes.
Now, there was some research a couple of years ago that showed when we sleep, the brain washes itself. That it actually, we didn't even think the brain had a lymphatic system. So they call it the glymphatic system. And I watched these beautiful movies of this system actually doesn't open up to any significant degree until we go to sleep. And when we sleep, the brain then washes itself. And so if you're not sleeping, trash builds up, especially beta amyloid, that it causes the plaques we think are partly responsible for Alzheimer's disease. And so isn't it interesting, Reagan, who didn't get a lot of sleep, ended up with Alzheimer's disease. Margaret Thatcher, who only slept 4 hours a night, ended up with Alzheimer's disease. Winston Churchill, who only slept 4 hours a night. I'm concerned about our current president, who only sleeps 4 hours a night. And judgment goes down when
For sure.
sleep goes down as well.
Well, and
It
there's
really does,
there's lots of studies on that.
There are many studies.
Even losing 1 hour of sleep
Even
causes
losing
it.
1 hour of sleep. In
Yeah.
fact, they've looked at people who drive after being sleep deprived. They drive as if they would if they were drunk.
It's almost worse, right?
Yeah.
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 We used to
Same
get
with
in the trauma
athletes.
unit. We used to get almost as many people who got into near fatal accidents because of sleep deprivation.
Yes.
I think that kills as many people
Yeah.
as alcohol.
It kills 6,400 accidents every year in the US, fatal accidents
Wow.
because of drowsy driving.
Wow.
If you think about it, when you're nodding off, that takes 3 to 5 seconds. If you're driving at 65 miles per hour,
Right.
you're traveling 95 feet per second. So by the time you nod, you've driven around 300 feet. Asleep.
That's how my sister got into the accident with me. She got into an accident driving 75 miles an hour and rolled the car 2.5 times. And I was I was a ICU nurse, and I worked at night for a while. And it's when I hated it because I had to like eat all night to try and stay awake.
Yeah.
And so because I'm not a night person.
Shift work
At
is going
all.
to increase the risk of sudden death and heart attacks as well.
Oh, it's
So I'm
terrible.
glad you're not doing that.
And the way I
anymore.
was eating was just terrible. To try,
Yeah.
I'm like I was so afraid I was going to kill someone, so I was eating whatever I could to just stay awake and not make a mistake. But then I would get off work, and it was when I nodded off at the wheel that I quit. I quit like right away.
Good.
I'm like, this can't work. I'll find something else.
It's interesting you mentioned that because when you are sleep deprived, you will be hungrier. The hormone leptin that regulates your appetite can't work well enough. In fact, for every 4 hours of sleep deprivation you have, your body thinks you need 900 more calories.
Ooh.
So you'll be eating more, you'll be gaining more weight. It'll cause you further sleep disruption, especially if you have sleep apnea.
Well, maybe that's why nurses tend to gain a lot of weight.
Maybe.
Interesting.
Right, because you go, we're a healthcare organization. Why are we not healthy
But your
ourselves?
priority
and some of it
becomes-
can be the mechanism.
Right. Some of it becomes
Exactly.
caring for, like, you have to pay attention to what's going on with those patients. You can't afford
But
to
we're
lose
not
focus,
caring for the
right?
caregivers.
We're not caring for the caregivers. You know what they say on airplanes, right? Put a mask on yourself before helping the person next to you. But if you're always vigilant on guard, you want to do the best job you can as a
We can't
healthcare
afford to lose that.
practitioner, you can't. There are lives at stake over
Right.
there. But at the same time, you're actually training your brain to be hypervigilant around the time you're supposed to be sleeping. Same thing I've seen in our vet population, the people who coming back from the wars. They're in danger mode all the time, and
Yeah.
it's going to destroy your sleep.
So, what impairs sleep? What are the things that cause people to have problems sleeping?
Well, broadly, we can think about those as predisposing factors, genetically, or the way your circadian rhythm, your internal biological clock works. There's precipitating factors, say a bad breakup, severe stress, or a certain medication that can disrupt and destroy your sleep. Not many people are aware of this, right? Almost every medication can have an impact on your sleep. Does it cause more dream sleep, less dream sleep, more deeper sleep, less deeper sleep? How does that cause your brain to function even in the next day? And then, of course, the perpetuating factors. Those are the learned behaviors. What are we doing in our part as well to perpetuate the insomnia? It could be things we think are good, like maybe if you can't fall back asleep, lying in bed, tossing and turning. That's one of the worst things you could do because then you're associating the brain with wakefulness in the bed. So
Makes sense.
broadly, those are the predisposing factors, what makes you initially at risk, what triggers the sleep problems, and then what perpetuates them. And then
So we should probably have a couple of cocktails before bed to. A lot of people do that, right?
Well, 'cause they have a
so
hard
some
time
of the
shutting their
things
brain off.
that a lot of
Yeah.
people do.
Yeah.
So they go to Ambien quickly.
Oh, terrible drug.
Which is insidious because once you start it, it's really hard to stop it.
really hard to
Right?
stop it.
They use alcohol as a way to sort of settle themselves down, but 3 hours later, when the alcohol's wearing off, it wakes them up. Plus, it's a diuretic, so they're going to have to go to the bathroom. Plus, it's hurting their brain, so they're more likely to continue to have sleep problems.
Yes.
So, what else do they do?
I don't like alcohol because
They're on their phone.
yeah, a lot of screen time. They're watching TV. They're reading in bed.
They're watching Fox or CNN, and
Yeah.
they're throwing stuff at the television because they're so angry.
Oh yeah, no, I stopped watching the news. I can't. I just cannot. I'll get the headlines. I'm done because it's just too disruptive. But reading actually makes me sleepy. So if it makes you sleepy, it's okay. Correct?
Not necessarily. So the way I go about thinking about this with my patients is, if they don't have a sleep problem, they wouldn't really come to me unless they want to maintain their gains and do what they're doing right and know what they're doing right and know what they're doing wrong. If you're sleeping well and you like reading at night in bed, that's okay. It's not ideal, but it's okay. But if you have a sleep problem, reading in bed is associated with keeping you up as well. So you need to break that cycle. Get a little comfortable cubby, create your own space separate from the bed. Could be nice comfort or
I
a little
see.
couch.
So maybe near your bed, but not in your bed.
Exactly.
Okay.
Because we need to break that cycle.
I always say read boring stuff that you think you should read,
Right.
but is boring. So biochemistry used to put me to sleep. Like it was
Right.
2 pages and I was done. Or if you read the book of Leviticus
Right.
in the Old Testament, you'll like be out, after the 17th, he begot
Right.
that person. When we come back, we are going to talk about some of the other significant causes of sleep disruption. And then we're going to spend the last 2 podcasts in this week talking about how do you get a better night's sleep. Stay with us.
Welcome back. We are back with Dr. Creado. He's one of our Amen Clinics doctors who is a sleep specialist. So you must listen to the first podcast. We're going to do 2 more on sleep. So welcome
good.
back, Dr. Creado. We're going
Thank
to talk
you.
about
And he's
things.
in our Chicago clinic.
Yes.
The polar vortex.
We're so
has
lucky.
left.
Yes. Yeah, it was crazy. It was
I
just
know.
insane.
I survived. All my fingers and toes are intact, which is good.
That was just insane. And then you
Yes.
came right into our rainy craziness here in California, which we rarely get. But for you, I guess that wasn't much.
No.
So let's talk a little bit more about sleep disruptors and what we can do. We'll get more into what we can do about that.
Yeah. So your sleep can be disrupted by anything. Interestingly, it could be a medical health issue like chronic pain,
Thyroid.
thyroid issues for sure, adrenal problems, hormonal imbalances. It could be the
Menopause.
menopause.
Teenagers.
Yes,
Menopause and teenagers.
exactly. So the older you get,
menopause is pausing from men.
Right, yeah. Or putting men on pause.
men will suffer from drops in their testosterone levels and they can suffer the consequences too. Then we talk about mental health issues too. If you look at any mental health disorder, PTSD, anxiety, depression, ADHD, there's always a sleep component there. There is sleep disruption there too.
People with ADHD, their cycles are often off.
Yes.
That they're not morning people. Trying to wake them is trying to wake the dead. And it's like not fun. And the restlessness causes them to have trouble settling down and going to sleep. Actually, a number of my patients, I've used stimulants at bedtime.
Oh, yeah.
Because it settles them down, which is like, that's totally weird.
I agree with you completely. And the thing is, if they have sleep deprivation, they're going to have more concentration problems. And what's going to happen? The doctor's going to give them more stimulants. And it's a terrible vicious cycle. So there are medical health issues we need to screen our patients for. There are mental health issues we need to screen our patients for when they have sleep disruptions. There's sleep disorders like sleep apnea, restless leg syndrome, circadian rhythm disorders. Are you a night owl or a morning bird? What medications are you taking? You might not really think of medicine may affect your sleep, but beta blockers for hypertension can disrupt your sleep. There are antipsychotic medications that may be sedating for you, great to go to bed, but they can also cause weight gain and worsen your sleep apnea if you do have sleep apnea as a cause for insomnia.
Right.
There are antidepressants that we prescribe to most of our patients with depression or anxiety, but those medications can worsen restless leg syndrome. So they may help you sleep better or help with the depression, but not help with the restless leg syndrome. Wellbutrin is a really good medication for depression, especially the limbic sort of depression, but it's going to keep you alert and awake. And there's benzodiazepines like Valium, Ativan, Klonopin that a lot of people take, but they're only supposed to be used short term for sleep. Long term, there's concerns for dementia, frequent falls, confusional awakenings, especially in the elderly. Do I want an elderly patient to fall and break a hip or drive and forget about what happened, like is seen with some other medications too? So we look at the health issues, the medications, we look at what their behaviors are. When I see a patient, I want to know exactly what they're doing prior to bedtime, around bedtime, how long it takes them to fall asleep, how many times they wake up, for how long, what time they actually wake up in the morning, how they feel, what happens during the course of the day as well. That influences how you're going to sleep at night. We talk about the drives to promote sleep, the circadian drive with the melatonin in your core body temperature, and the sleep need or the sleep debt that you build up during the day, and how it's supposed to synchronize for you to fall asleep
Gosh,
on
there's
time.
a lot.
So, given how complex it is, so I have this idea in my head that people are having trouble sleeping. So they go to their primary care doctor and they go, I have trouble sleeping. And they often leave with a prescription for Ambien or Xanax, which just starts a nightmare for them. And it totally goes against first do no harm. So can you begin to tell our listeners what are the things to do before you take a sleeping pill?
Absolutely. You're so right. If someone has fever, will they just take an ibuprofen? What happens if they have other symptoms? What if that fever is because of meningitis?
Right.
Right?
We're putting a band-aid over a bullet hole.
Exactly.
Yeah.
Exactly. It's not going to be effective. So that's one of the reasons I did sleep medicine too, because it was just shooting in the dark. I didn't like what was going on at all. Why just an Ambien or a Klonopin to help put somebody to sleep? What's the underlying cause of the sleep issue? That's where we want to focus. So even before you resort to medication, it's really important to dig deeper. See if there's any mental health issues, any medical issues, any medications that are affecting your ability to sleep. What are your sleep behaviors? What are your thoughts regarding sleep? If you're not being able to sleep well for a certain
Yes.
amount of time, you'll have all these automatic negative thoughts. The ants eat away at you while you're trying to sleep.
Can I say one thing about this? So this is really interesting because I went to a doctor when I was going through a divorce. It was really stressful for me. And they gave me Ambien. And what I noticed, and I don't know if anyone else has noticed this or if I'm just one of those weird people, but I didn't put it together at first. Next day I felt really depressed and I didn't know it was the Ambien. Like seriously depressed. I got really tearful for no reason. There was nothing triggering it. I just got tearful for like no reason.
Yeah.
And I didn't put it together. And then the next day I got like literally burst into tears. And I'm like, oh, this has to be the Ambien. I mean, I'm a nurse. I sort of put it together. I'm like, there's something wrong with this medication. It's definitely not affecting me in a positive way. Like it was just a crazy depressed type of feeling.
Yeah.
And so I took myself off the Ambien. It went away immediately.
Wow.
But I was seriously having trouble sleeping. I mean,
So
partially
that's
the thyroid.
exactly my point.
Right.
You just go, I have trouble sleeping. They give you a medicine that changes your brain to need it now in order to function.
Yes.
That has significant
Right.
side
And so, and
effects.
part of my issue is I have thyroid on top of that. I have this thyroid condition where they keep my thyroid jacked up in order to suppress cancer. Right. So it's my metabolism is like amped all the time. So what I ended up doing was going to see a therapist. And I was pretty anti-therapy at the time. in my head, I thought that it wasn't going to help. It helped so much. Going to therapy and then learning how to meditate.
Yes.
So those two things for me, critical. I mean, I did a whole bunch of other stuff because I'm one of those people, if I'm going to do it, I'm going to jump the canyon.
Yeah.
But those two things were where I started. And it was just learning how to just like settle my own brain down was just critical for me.
That's the key. In modern sleep medicine, we don't look at insomnia as a lack of sleep, but an excessive wakefulness of the brain. If your brain is in danger mode, fight or flight mode, there's no way you're going to be able to sleep properly.
Right.
So one of the core aspects is not trying too hard, because the more we try and control the situation, the more alerting it is to try and fall asleep. And then relaxing the brain through natural ways. So what about a wind down period, like a buffer zone
See, I need
prior
an
to
hour.
bed?
I need I know I need an
Exactly.
hour. So
It might be a
Okay,
warm
the
bath.
next two podcasts, we're going to talk about what to do. I want to know, so they can make an appointment with you.
Yes.
And you see people from all over the world, and you do a lot of phone appointments, even
Yes.
though you're in Chicago. What are
Just-
some
Skype
of
is
the
probably
other
a good way.
things
That's a
they
great
should
way as
do?
well.
yeah, Skype is a good
So
way.
Skype
Yeah.
would
Yeah.
be good. You have a new sleep course that you just created.
Yes.
That we're thrilled to partner with you on that. So we'll give a link to the sleep course so
Perfect.
people can take that. Because, you know, the reason I've written for so long and encourage you to do that is there's only so many patients we can see.
Yes.
But we have this information
Right.
that is so critical. And as you said, this is one of the most important things you'll ever do.
For
is
sanity.
get your sleep right. So they can make an appointment with you. They can take the course. What are some other simple things that they need to do? So what I've heard so far is they need to have their thyroid checked.
Yes.
That if they're not
Hormones.
sleeping with anyone,
Hormones.
then they probably need a sleep study so that because if you're not sleeping with someone, you don't know that you're snoring or that you're not breathing. You stop breathing
Yeah.
at night. So, and there are ways to do that, even home tests that people can do. What are some of the other things people should do to assess it before we get into here's the plan?
Yeah, in the sleep course that we've created, I have downloadable materials for patients as well. Just download a complete assessment form that screens and looks at everything from their complete bed routines to all the substances they may be using, to all the medications they're on, screening them for sleep apnea, restless leg syndrome. Everything that we can screen them for is right there.
One thing I heard, and I don't know if this is on your assessment because I heard this, and maybe I'm sensitive to it. You mentioned if you are in flight or fight all the time, if you're feeling like you're in danger all
Yes.
the time, you're not going to go to sleep because you're alert. So for those of us who grew up in sort of chaotic environments, he knows I'm always looking over my shoulder.
Yes.
I'm always looking around. I'm always paying attention. He's always looking
She's
for the
so
happy
funny.
faces.
She's looking. She has an FBI agent's brain.
Right.
And we actually have on Brain Fit Life, we have a game. that
Yeah, I
teaches
hate this
people-
game. It's the dumbest game
hang
ever.
Hang on. That teaches people to notice what's right rather than what's wrong. So they look for the happy faces and ignore the bad
Yeah, that's
faces.
never gonna happen.
The dangerous faces. And she's
Dumbest
like,
game ever. I'm like, no, why do I care about happy people walking by me? I care about the terrorist or the gangbanger. I don't care about happy people. They're
But that's
fine.
why you're not sleeping.
Okay, but that's not my world. Like, I didn't grow
Because the
up
guy
in that
next to you
world.
is not a terrorist.
Okay, I didn't grow up in that world. I got cameras around my house. I got alarm systems. Like, yeah, no.
Yeah.
More like-
Yes, chaotic environments can definitely disrupt your sleep. If your brain is in danger mode, obviously you're not going to be able to calm down and relax. A lot of people with anxiety have also experienced hypervigilance, and you need to protect yourself in some ways. A lot of people who face trauma might have faced trauma in the bedroom as well. And
yeah, it's a big one.
It's a big one. They also want to avoid nightmares, so they try and delay sleep as long as possible. But the thing is, if you are sleep deprived, your brain will try and make up for it with more dream sleep,
Right.
which will worsen the nightmares.
Yeah, more anxiety.
So, absolutely. It's all discussed in the course as well, and
Perfect.
specific strategies how to address these issues depending on what you're dealing with. It's very precise,
I love
catering
that.
to each person
All right,
what they
we're
need.
going to talk more about it.
Sounds
Stay with
good.
us. Welcome back. We are in the middle of Sleep Week, and we've talked about a number of the causes of trouble with sleep. We talked about how critical it is
Yeah.
to the success
So
of
important.
your life.
Yeah.
But now let's talk about how to get and stay asleep. So, what are some of the highlights? What are some of the most effective things you've seen to help your patients?
Well, the most effective strategy to help with insomnia is something we call cognitive behavioral therapy for insomnia. Not many people are even
I would
aware
have
of
never
this.
thought of that.
Exactly. Not many people are aware of this, but this is the therapy that's the gold standard. It's approved by major international sleep organizations. Not Ambien, not Trazodone, not gabapentin, not Klonopin, but cognitive behavioral therapy for insomnia. And that's a cornerstone of the course that we've just created for all our patients and friends and family.
So, how does it work? And I know, we would love for them to take the course, but what's the short story?
The short story is that it addresses everything starting with an understanding of why we sleep, the rhythms that are associated with sleep functioning, circadian and homeostatic drives. We talk about everything from understanding why those therapies or strategies are useful based on our knowledge of sleep, natural supplements and ways to deal with effective sleep, and then dive right into the meat of things. Everything from behaviors and thoughts surrounding the sleep or lack thereof, as well as ways in which we can regulate our rhythms. If you're in bed for 9 hours, only getting 6 hours of sleep, we need to reduce the time in bed because you're lying in bed, associating the bed with wakefulness, tossing, turning, worry, and then your brain thinks that's your worry time. So first of all, if you can't fall asleep within 20 minutes, get out of bed, comfortable chair, do a meditation, do something relaxing, no screen times, because you need to break that cycle between wakeful worry and the bed. Then get back into bed. If you're awake for 9 hours, only getting 6 hours of sleep, reduce your time in bed to 6 hours. People think I'm crazy for saying that, but they say I'm not going to be able to sleep. Well, are you sleeping anyway? If we do a sleep diary that are available with the materials in the course, you can actually track and see how much sleep you're getting. So if you're sleeping for 6 hours but only in bed for 9 hours, reduce that time. You're allowing your brain to get the same amount of sleep you get anyway. Keeping your wake up time fixed is really crucial because we're trying to entrain the inner rhythms to align themselves in the brain. So if you're waking up at 6 a.m. one day in the weekend, waking up at 9 a.m., it's going to throw your inner biological clock off every time. You're basically making your brain go through jet lag every week if you think about it. So always having a fixed wake up time, calculating how many hours you need and going to bed at the appropriate time. Wind down before bedtime. If you wake up in the middle of the night, get out of bed, get comfortable, get back to bed when you're sleepy. Most people don't know the difference between sleepiness and fatigue.
This is so interesting. So I've heard a lot of stuff on sleep, and most of it is sort of repetitive. It's the stuff we think about: darken your room, make it cool, all that stuff, which is important. But you're addressing things I've never heard of, like if you've been traumatized in the bedroom, or just some of the stuff you're talking about is really deep. So it's just so important that these things are addressed, and I just am loving what I'm hearing, especially some of the things. Not just women, everybody, but it's just such a thing that I've never heard someone address these topics for sleep. So I just am fascinated by this. And one thing I want to throw in there, my sister actually went to the doctor because she went through a highly traumatic experience. They gave her gabapentin. She fell asleep on the toilet, fell off the toilet, and hit her head on the bathtub. So just throwing that out there.
Right. And that's another point you raise. A medication may be okay, but is it the right medicine in the right dose
Is it
at the
optimal?
right time
Right.
for the right patient? Gabapentin is great for restless legs, can help you sleep better. But if it's too much or you're too sensitive to a certain medicine at a certain dose, that's what's going to happen.
Yeah.
Would you rather have a head injury or break a hip, or would you rather sleep better through natural ways?
Right. So it just seems to me like it's at least where you should start is working on your thoughts and clearing up.
So we need
whatever's
to
going
get
on.
the ants out of bed.
Get
Yeah.
ants
Oh, I
out of
like
bed.
that.
So a lot of people have an ant infestation in their bed,
Yes.
under their sheets, the automatic negative thoughts
That's really
that
good.
steal your happiness. So learning how to not
Get the
believe
ants out of
every
bed.
stupid thing you think is really critical. I mean, it's important. So, but also, because I know you, it's a routine. If your routine has been one that is sleep harming, let's put you in a routine, because your brain can then begin to associate sleep with the right
Now, is that what we call
routine.
sleep hygiene?
Exactly. It's component of sleep hygiene, and also another concept in CBT for insomnia called stimulus control. You want
Let's make sure that they didn't hear what I heard the first time I heard CBD. So let's make sure we're hearing this correctly.
CBT, cognitive behavioral therapy for
Right.
insomnia. Now,
Well, but why you brought that up? So what's the deal with CBD and sleep? Everybody's taking
it's a
it.
big thing now, so that's why I thought I heard
They're
it.
giving it to their granny. They're giving
Right.
it to their dog who's
Right.
got arthritis.
I mean, I know a minister
What
taking
about
it.
CBD and marijuana for sleep?
well, we all know the bad effects in terms of marijuana, right? In terms of your increased risk for schizophrenia, to low blood flow in the brain. In the scans, we've seen that every single time. CBD oil, there's more research that needs to come out, but from what I've seen thus far in terms of insomnia, CBD oil may be helpful for insomnia, but in very high doses. So it might be more expensive for people, and depending on your brain sensitivity, I don't know what kinds of side effects you'll have. So until more evidence is out there in support of CBD oil, it's definitely not my first, second, third, or even 15th step in terms of a person with insomnia.
Okay.
Isn't that interesting? I'm working on a new book called The End of Mental Illness, and I'm in a chapter called Mind Meds versus Nutraceuticals. What does the science say?
Right.
And for example, if I look at depression, the Prozac is 13th on the list, right? Where things that are much higher up are cognitive behavior therapy and omega-3 fatty acids, maybe SAMe. So rather than what most people do, go to the primary care doctor and get a drug, there's so many other things to do first. And that's what you talk about in the course, and it's what we're talking about today. So let's go through the steps. So before I get to Ambien, and quite frankly, I don't think I've prescribed it in the last 5 years, because it's not really even on my list, because my mom took it forever and then she couldn't stop taking it.
Yeah.
And I wasn't the one giving it to her, trust me. So give us the top 10. What would you do? What would you start with if someone has got erratic sleep?
If someone has an issue with insomnia or disrupted sleep, the first thing is you look at is a bed environment. Is it comfortable? Is it conducive to better sleep? You look at what they're doing during the day. Is it something activating closer to bedtime? Caffeine, for example. Some people may feel that caffeine is okay for them to take in the afternoon, but if their brain is more sensitive, then avoid caffeine during the day, even if it's in the afternoon. If you're taking caffeine with an SSRI, an antidepressant, or with hormone replacement therapy, or with an oral contraceptive, caffeine is going to last longer in your system.
Oh, interesting.
It's going to activate you, right? If you're taking alcohol too close to bedtime, it's going to wake you up in the middle of the night. If you're exercising, which is a great thing to do in the morning, too close to bedtime, it's going to make you more activated.
Yeah, I have
or
that problem
energized.
too.
Exactly.
Can't settle down.
So a few of those basic concepts, your behaviors first need to be taken care of. Screen time, reading, watching TV in bed, all gone. You need to have that barrier there. We talk about blue light and white noise as well. Once those are taken care of, you can look into the medications you've already been prescribed. There's lots of information on the internet. See which ones may be sleep disrupting for you. Look at any thyroid issues you might have or any other health issues. Chronic pain is a big one too. And by doing that, you can actually eliminate or deal with those initial things way before you resort to medication like Ambien. There are medications that can knock you out, like antipsychotics, but they're dirty medicines. They cause a lot of side effects as well.
Dirty medicines. I like that. Dirty
You
medicine.
can't fish in muddy water, right?
I like that.
Okay, so sleep hygiene. One of my favorite things has been hypnosis.
Yes.
And I actually have a
Love
hypnotic
it.
on Brain Fit Life. I have a hypnotic thing
Yes.
for sleep. I think my first 3 published papers they were like miraculous things using hypnosis for sleep. Parkinsonian tremor went away when I put a person in a trance for sleep, even before he went to sleep. A heart arrhythmia normalized
Wow.
under hypnosis for sleep. So
I love
that
hypnosis
can
and
be
meditation.
positive.
Yes.
In your course, you have a meditation that
Yes.
people can do. And I know Tana has meditations on her site. So
I'm not a meditation expert. I just found that it really works
it's
for me.
retraining your brain to a calmer state. And then when we come back, we're going to talk about supplements. And okay, if you have to use medicine, what are some of the ones that won't get you into trouble?
Okay.
Stay with us. Welcome back. Thanks so much. We've had such a good time with Dr. Creado. He's a treasure for us and a wonderful resource for you. So in this last session, and we did this purposefully, that medications are not the first thing you should do.
Yeah.
The first thing you should do is really understand why you're having trouble, and then fix that if you can. Fix the structure, fix your thoughts, fix your routines.
Yes.
But supplements can actually be very helpful. And we like to do supplements first and then medications. So walk us through your thought process on supplements and medications for sleep-related issues.
Okay. Now, if we first of all address these behavioral strategies, the sleep hygiene, the bedroom, and we're making sure that there's no serious underlying issues like sleep apnea, restless leg syndrome, then we talk about some helpful supplements. Usually patients come to me on a boatload of medications, and I'm in the process of eliminating medications rather
Right.
than adding more.
Right.
That's the first step you do, because medications can disrupt your sleep. Talking about supplements, there are a few supplements, I would say 10 to 12 supplements I really like that also have the best evidence in support of their use for people with insomnia. One of them is 5-HTP, and it's in serotonin mood support, brain MD, and supplements. What I like about 5-HTP is that it gets converted to serotonin, and serotonin regulates your mood as well as your sleep. So it can help you sleep better. Also, 5-HTP is necessary for serotonin and melatonin production. And as we know, melatonin is extremely helpful for helping us sleep better. However, melatonin is not really taken in the right amounts and the right duration by the right people, and therefore they may over-medicate with melatonin, and they may have actually bad effects or paradoxical effects.
So what dosages do you like of melatonin?
0.5 to 1 milligram, which is people might think is really low because typically in pharmacies you get 3, 5, 10, 15 milligrams, but that's way too high. When we think about melatonin, the levels rise at night around bedtime, so it helps nudge your brain into sleepiness. It's as effective as switching the lights off. It's not supposed to knock you out, and it's only helpful in helping you fall asleep. And it needs to be taken 90 minutes or 60 minutes before your bedtime. So people may take a higher dose, may lie in bed tossing and turning, wondering why it's not working for them. Well, they've taken it too late. Then they start associating the brain with tossing and turning and wakeful worry at bedtime, which will even perpetuate the insomnia.
So what if they've been doing what most people do and taking higher doses, 3 to 4 milligrams or 5 milligrams? Can they just automatically back off and take less, or do they need to wean down?
They can take less because there's no terrible withdrawals from the higher doses of melatonin. Depends on how much you've been taking as well. It's going to be rough. I always tell my patients, if you want to get this right, you've suffered from insomnia for a long time, months, years, you need to put in some effort. If you think about it, if there's anything you're proud of, anything you've achieved in life,
Yeah.
you've put in a lot of hard work
I tell
into
people
it.
the same thing, right?
Exactly. So
What are you most proud of?
very true.
So low-dose melatonin,
Low-dose melatonin,
5-HTP.
5-HTP.
50 milligrams, 100 milligrams of 5-HTP.
Yes, start low, go slow, see whatever you need, and that's how you go with that. Also, GABA is a really great supplement to help you sleep better. It can calm down the nervous system a little bit, helps you more get into a state of relaxation. Could help calm down some excitatory
So like
neurotransmitters.
500 milligrams of GABA, 750.
500, and then you try 750.
So a lot of people go, but GABA doesn't cross the blood-brain barrier. and I don't know whether or not that's true. We've actually done quantitative EEG studies that show GABA elevates theta activity, slow brainwave activity. So maybe what it's doing is it's calming the vagal nerve, which is then sending a signal to your GI tract to calm everything down. And people don't get the gut brain connection,
Yes.
but there's actually a study on probiotics being helpful to induce sleep, which I thought that was pretty interesting.
That's really interesting. And you and I had a little conversation a while back, just a little while ago, about tea.
Yes.
So I like to take valerian tea. I also like chamomile tea. So if it's evening, I'm one of those people, I'm highly sensitive to caffeine anytime other than in the morning. So I cannot have caffeine anytime past 11.
Right.
Okay, so that would not be one of your supplements.
Most definitely not. But so if it's in the evening, I will have I can't have green tea, nothing like that. So I will have chamomile tea if I'm out at dinner or something like that. But I like valerian tea at bedtime. So talk to us about tea and why they work and which ones are good, which ones are not good.
Yeah, the top two would be chamomile tea and valerian tea. So you're doing
Okay.
it right, clearly, Tana.
Okay.
Chamomile tea is really helpful because it's rich in a flavonoid called apigenin, which binds to the benzodiazepine receptors in the brain. The same receptors in the brain help you
Oh.
calm down and relax.
So it's not just sort of a
Naturally.
myth. It actually works.
No, it does work.
Okay.
So valerian root
Now,
as well can be very
theanine
helpful.
works as well.
Mhm.
So you wonder about decaffeinated green tea
Oh.
because it has theanine, or you can just take theanine by itself. There's actually a study
But
on
doesn't that make you focus
postmenopausal
more?
women. A lot of people
Yes,
put it
yes,
in
yes.
sleep formulas. So
Yes.
what do you think about theanine?
I'm confused.
I love L-theanine. It can be extremely effective because it can help regulate your dopamine, your serotonin, your GABA
Oh.
as well. There are studies that looked at ADHD in kids and L-theanine, help them calm down and relax and sleep better. I'm a fan of L-theanine. It's in my top
Just not
10.
the caffeine
Not
that's
the
in the
caffeine.
green tea.
Not
okay.
the caffeine.
Not-
Okay, and valerian
we are
is a good
not
one.
a
We talked
fan of
about valerian.
caffeine.
Valerian is a good one as
Unless
well.
you have a sore throat and it
Question, though.
constricts blood flow to your throat.
Question though, some people say they get weird dreams on valerian. I don't, but is that something that's common?
It could be possible. It depends on the dose
Okay.
and the taking and the duration as well. As I said, if you are sleep deprived, your brain will try and make up for it by more dream sleep.
Ah.
So they're sleeping better with the valerian. They might actually have more dream sleep initially, and
But then it
by
will calm
more
down.
Exactly. That's the way it should work.
Okay, so we have low dose melatonin, 5-HTP, L-theanine, GABA, hypnosis, meditation. So I just want you guys to hear.
Magnesium is like
the
my
first
go-to.
thing is not Ambien.
Right.
Now, if the lifestyle and supplement things are not working, what are the medications you go to in the order that you might use them?
Okay. The first step is eliminate any meds that are disrupting your sleep. So you need to work with your doctor or look into the research and look at what meds may be damaging your sleep. Because there might be certain sleep medicines that might worsen things like sleep apnea or restless leg syndrome. So if you have sleep apnea, one of the worst medications you could give someone is Klonopin or benzodiazepine like Ativan.
But they do it all the time.
They do. And then what happens? Their sleep is worse. They're suffocating. They have more depression. And then they increase the dose. So you're not sleeping well, let's increase the dose. It worsens the sleep apnea. It's a disaster.
Yeah.
So the
Okay,
cleanest
so you don't like
medications-
those. Which ones do you like?
If we're just talking about pure insomnia and supplements, natural strategies, and then looking at a medication option, I'd actually go with low-dose gabapentin. Low-dose gabapentin, because it's such a huge therapeutic window. You can give 100 milligrams or 3,600 milligrams in a 24-hour period. So slowly titrating gabapentin, what I like about it is even if someone has low iron levels in their body, they don't know about it, or there's a mild restless leg, it can deal with that as well. It's one of the best medications for restless leg syndrome. I like Lunesta and Belsomra. They're more selective medications, less side effects.
So they don't have the same side effects that Ambien has.
No, Ambien is also associated with sleepwalking, sleep talking.
Oh, interesting.
There are a few forensic sleep cases there where someone has done something in their sleep.
Ooh.
And it's a crime. It's usually a serious crime. And then,
And is the depression that I experienced, is that a common thing or is that just sort of a weird?
no, it's definitely possible with Ambien too.
Okay.
On the labels, there are so many different side effects for each medication. But the reason they're all there is because one person might be affected. Even if it may affect 1% of the population, What if you're my patient within that 1%? Then it's 100% for you.
Right.
And that's really important.
Right.
And a lot of my patients take Seroquel, and they actually get a good response for that for sleep. What's been your experience?
Sedating antipsychotic medications like Seroquel or olanzapine or Zyprexa can help you sleep better. But the reason they help you sleep better is because it's a very potent side effect of the medication. So, as I said, these are medications that have multiple effects. So if you have restless leg syndrome and you're giving them an antipsychotic like Seroquel, what's it going to do? It's going to block the dopamine receptors, probably make your restless leg syndrome worse. If you have sleep apnea, Seroquel and Zyprexa can cause weight gain and worsen the sleep apnea. So they're definitely lower on my list of things to do. First, I'd go with boosting the iron and the natural supplement reserves. Then I'd go by the medications that I mentioned to you. Lunesta,
So
Belsomra.
low iron goes with insomnia.
Yes.
So I
Oh, that's not good.
hadn't heard
I
that.
always have it.
And giving iron can actually help
Yes.
insomnia. Now, does their iron have to be low in order for it to work for insomnia?
So they don't have low iron.
Well, it depends on whether you're talking about the iron levels or the storage form or the ferritin levels.
Right.
What I like to test, and we all test our patients for this, is the ferritin levels, a storage form of iron.
Right.
And it doesn't have to necessarily be within normal limits. I want to see it in the higher range of normal, because then you know someone has good iron reserves. Why is that important? Iron helps your brain produce dopamine.
Wow, I've just learned so much during this. This is so interesting.
Right, because your iron levels
Always
came back
chronically,
terrible.
it's chronically low, and I upped my ferritin.
Yeah.
So
So what's going to happen when you have low iron levels? You'll have less dopamine, or your dopamine is not going to work as well. So you'll have more anxiety. You'll have
well, I was in a
concentration
funk.
problems.
Yeah, I was like not concentrating as well, and I was feeling kind of funky, just not happy as like I normally am, bubbly.
Yes.
So I increased
So
my
if
ferritin, felt
you
better.
have found this
And you have
helpful,
restless leg issues too.
Dr. Creado has a brand new course. It's 21 lessons. And
So
it can
interesting.
change your life.
Yeah.
Because change your sleep, change your life. It's so
If I
important.
miss a half an hour of sleep, it changes my life. So if you're
Which in turn
chronically,
changes my life.
right. So if you are chronically sleep deprived, it's just a terrible thing. So
You know, as the saying goes, we are inundated with information, but thirsting for wisdom.
yes,
And
that's
this,
so good.
This is the course for people who have been shooting the dark all along, trying to find solutions, struggling with this by themselves. This will give them tailored, directed information on how to improve their sleep in a meaningful way.
Well, you are a wealth of information and wisdom on this topic. It's been fascinating.
It's been fascinating. I'm so grateful for you guys to come on the show and help people out. So thank you so much for having me.
Thank you for being here.
If you want to learn more about this course, actually, you want to learn more about
Yeah,
this
you do.
course, go to amenuniversity.com. If you're interested in coming to the Amen Clinics, use the code podcast10 to get a 10% discount on a full evaluation. Visit amenclinics.com.
If you're enjoying our podcast, please don't forget to subscribe so you'll always know when there's a new episode.